Hey everyone, let's talk about anxiety. We all experience it sometimes. It's that feeling you get before a big test or a first date. It's normal to feel anxious occasionally, but for some people, anxiety is a constant companion. It can feel overwhelming and scary. So what exactly is anxiety? Imagine your brain has a danger alarm. Anxiety is like that alarm going off. Even when there's no real danger, it's your body's natural response to stress, but sometimes that response gets stuck in overdrive. Anxiety is more than just feeling stressed or worried. It's a group of mental health conditions that can affect your thoughts, feelings, and behaviors. It can interfere with your daily life, but the good news is anxiety is treatable. There is hope, and you don't have to go through this alone. Anxiety isn't a one-size-fits-all experience. It comes in different forms, each with its own set of characteristics. Let's take a look at some of the most common types of anxiety disorders. First up, we have generalized anxiety disorder, or GAD. People with GAD experience excessive worry and anxiety about everyday life events. It's like their worry switch is permanently stuck in the on position. Then there's panic disorder, characterized by sudden and intense episodes of fear known as panic attacks. These attacks can be terrifying, often accompanied by physical symptoms like a racing heart, dizziness, and shortness of breath. Social anxiety disorder, also known as social phobia, involves an intense fear of social situations. People with this disorder often worry about being judged or embarrassed in front of others. Imagine this, you're about to give a presentation, your heart starts pounding, your palms sweat, you feel dizzy. You might even feel like you're going to be sick. These are all common physical symptoms of anxiety, but anxiety isn't just physical. It affects your thoughts and emotions too. You might find yourself worrying constantly, even about things you can't control. You might feel restless, irritable, or have trouble concentrating. Anxiety can make it hard to sleep. You might toss and turn all night, your mind racing with anxious thoughts. It can make you want to avoid situations that trigger your anxiety, even if those situations are important to you. So, what causes anxiety? Well, it's a bit of a mystery, like trying to solve a puzzle with missing pieces. Anxiety is complex, and there isn't one single cause. It's often a combination of factors like genetics, brain chemistry, and life experiences. Think of it like this. Some people are born with a predisposition to anxiety, like a blueprint passed down through generations. Others might develop anxiety due to imbalances in brain chemicals, those tiny messengers that control our mood and emotions. Life experiences also play a significant role. Traumatic events, chronic stress, or even major life changes can trigger anxiety in some individuals. It's like our brains are wired to remember and react to past threats, even when those threats are no longer present. Section 5. Anxiety's calling card. Recognizing the symptoms. Anxiety can manifest in a myriad of ways, affecting individuals both physically and mentally. Recognizing the symptoms is crucial in seeking timely intervention and support. While the experience of anxiety varies from person to person, there are some common telltale signs. On the physical front, anxiety can manifest as a racing or pounding heart, often accompanied by shortness of breath. Muscle tension is another common symptom, leading to headaches, backaches, and overall discomfort. Digestive issues such as stomach aches, nausea, and diarrhea are also frequently reported by individuals struggling with anxiety. Mentally, anxiety can wreak havoc on one's thoughts and emotions. Excessive worrying, often about things beyond one's control, is a hallmark symptom. Restlessness, irritability, and difficulty concentrating are also common, making it challenging to focus on daily tasks. Sleep disturbances, including difficulty falling asleep and staying asleep, can further exacerbate anxiety symptoms. Section 6. Living with the what-ifs, real-life examples of anxiety. Let's put a face on anxiety and explore some real-life examples of how it can affect people's lives. Meet Sarah, a college student who experiences social anxiety. She dreads going to parties and often avoids social gatherings for fear of judgment and awkward interactions. Then there's David, a young professional struggling with generalized anxiety disorder. He constantly worries about work deadlines, his finances, and his relationships. Even when things are going relatively well, his anxiety often leads to difficulty sleeping and concentrating, impacting his overall well-being. And let's not forget about Emily, a single mother who developed panic disorder after a traumatic car accident. She experiences sudden and intense episodes of fear, accompanied by a racing heart, dizziness, and shortness of breath. These panic attacks can strike at any time, making her feel constantly on edge. Section 7. Taming the worry monster. Practical tips for managing anxiety. Living with anxiety can feel like you're on a never-ending roller coaster of worry and fear. But here's the good news. There are practical steps you can take to manage your anxiety and regain control of your life. First and foremost, prioritize self-care. Make sure you're getting enough sleep, eating a healthy diet, and engaging in regular physical activity. Exercise, in particular, has been shown to have mood-boosting effects and can help reduce anxiety symptoms. Challenge negative thoughts and replace them with more positive and realistic ones. When you find yourself spiraling into a vortex of what-ifs, take a step back and ask yourself if those thoughts are based on facts or just your anxiety talking. Practice relaxation techniques such as deep breathing exercises, meditation, or yoga. These techniques can help calm your mind, reduce physical tension, and promote a sense of well-being. Section 8. Finding your calm amidst the storm. Relaxation techniques. When anxiety threatens to engulf you, relaxation techniques can be your lifeline, providing a sense of calm amidst the storm. These techniques are like tools in your anxiety-fighting toolkit, helping you regulate your body's stress response and regain control. One of the simplest yet most effective techniques is deep breathing. When you're anxious, your breathing tends to become shallow and rapid, further fueling the anxiety cycle. Deep breathing exercises such as diaphragmatic breathing or box breathing can help slow down your heart rate, reduce muscle tension, and promote a sense of relaxation. Meditation, another powerful relaxation technique, involves focusing your mind on a particular object, sound, or sensation. By training your mind to stay present and let go of distracting thoughts, meditation can help reduce anxiety, improve focus, and enhance overall well-being. Yoga, with its combination of physical postures, breathing exercises, and meditation, offers a holistic approach to managing anxiety. The physical postures help release muscle tension, while the breathing exercises and meditation calm the mind and promote relaxation. Section 9. Seeking professional guidance. When anxiety takes center stage. If anxiety is significantly impacting your daily life, don't hesitate to seek professional help. Just like you'd see a doctor for a physical ailment, seeking mental health support is just as important. Mental health professionals, such as therapists and counselors, are trained to help individuals understand and manage their anxiety. They can provide evidence-based therapies such as cognitive behavioral therapy, which focuses on identifying and changing negative thought patterns and behaviors that contribute to anxiety. In some cases, medication may also be recommended in conjunction with therapy. Antidepressants and anti-anxiety medications can help regulate brain chemicals that play a role in anxiety. It's important to consult with a qualified healthcare professional to determine the most appropriate treatment plan for your individual needs. Section 10. Remember, you're not alone. Support systems and resources. Dealing with anxiety can feel isolating, but it's essential to remember that you're not alone. Many people experience anxiety, and there are resources and support systems available to help you navigate this journey. Reach out to trusted friends, family members, or a support group. Talking about your anxiety with someone you trust can provide a sense of relief and understanding. Support groups offer a safe space to connect with others who share similar experiences, reducing feelings of isolation and providing valuable coping strategies. Numerous online resources and organizations provide information, support, and tools for managing anxiety. The Anxiety and Depression Association of America and the National Alliance on Mental Illness are excellent starting points for finding reliable information and support services. Section 11. Hope on the horizon, a final word. Anxiety can feel overwhelming, like a dark cloud constantly looming overhead. But remember, there is hope. With the right tools, support, and self-care, you can manage your anxiety and live a full and meaningful life. It's a journey, not a destination. There will be ups and downs along the way, but with each step you take towards understanding and managing your anxiety, You're paving the way for a brighter future. Remember to be kind to yourself, celebrate your progress, and never hesitate to reach out for help when you need it. You are stronger than you think, and you don't have to face anxiety alone. There is hope on the horizon.